Hey folks, I'm back. Rebecca Lauderdale here on behalf of the Mississippi State Medical Association. This is my sort of third and longest installment about National Physician Suicide Awareness Day, which is Saturday, September the 17th. Many of us have had the most emotionally, financially, physically stressful years of our lives over the past 2.5 years during the pandemic. Burnout rates are at an all-time high for physicians. We know that burnout is tied to rates of depression and suicide. And even before the pandemic, physicians had one of the highest rates of suicide of all professions in the United States. So I'm here as a fellow physician to offer support and resources for you if you or someone you care about or work with are struggling with depression or other mental illness or potentially suicide or suicidal ideation. Before going any further, if you feel isolated or alone, like you've lost your sense of purpose, you feel ineffective, if you started to use substances to medicate yourself from the discomfort of daily life, you're not alone, even though it feels that way. There are a lot of us who have been through what you're going through, and we want to help. Depression and suicidal ideation are treatable and temporary, but the big lie of depression is that you're alone. So the problem with us physicians is that we've been conditioned even more so than the general public to have a stigma around mental health issues. We often feel like we can't take the time to get treatment. And so many doctors who have depression or suicidal ideation cite reasons for not seeking treatment, like fearing professional repercussions. Trainees often mention that they're afraid it'll go in their academic record and that they'll be penalized for it. They're afraid of asking for help. They're afraid of asking for time off to get treatment. Practicing physicians cite reasons like concerns over having to report receiving psychiatric treatment to credentialing or licensing boards, or feeling like they'll have to be treated by someone in their own system, someone who is essentially a colleague or a supervisor or who answers to a supervisor. And we've probably all heard horror stories of people being reported essentially for seeking treatment for mental health issues. So when I experienced depression several years ago, the thing that finally made a difference for me and got me to seek treatment was meaningful connection with others. But there was a lot of shame and fear to get over before I could even do that. So I understand how hard it is. For those of you who know someone that you suspect may be struggling with mental health issues, depression, substance abuse, and it may be at risk for suicide, there are some signs of personal crisis that can precede suicide that you can look for. So what we know is there can be signs of substance use or abuse kind of escalating, but not always substance abuse, obviously. That's not always involved. Mood changes, anxiety, agitation, anger, loss of interest, reporting feeling like they've been humiliated or shamed, and expressing a sense of not having a purpose. There are other experiences that are risk factors for suicide, and that's being named in a malpractice, major relationship problems like divorce or separation, having financial difficulty, which so many of us have had during the pandemic. So when you suspect this in a colleague, somebody you care about, it's really important not to worry about having the exact right words. Asking about self-harm doesn't increase the risk of suicide. But the first thing you can do is just say, hey, how are you? I notice you don't seem to be feeling like yourself. Or, I'm worried about you. If they open up, then you can let them know about resources like the Physician Support Line, which is a free support line for physicians staffed by psychiatrists for physicians, confidential. There are also other resources you can find at npsaday.org, and also the Mississippi State Physicians Health Program. That's msphp.com, which is a program for any sort of mental illness or substance abuse issues for any Mississippi physician, and it's confidential. So for those of you who are personally struggling with depression, substance abuse, or other mental health issues. Sometimes I felt like, like I mentioned above, listening to others tell their stories were some of the most impactful things that helped me move toward healing, away from feeling shame about what I was experiencing, and also feeling hope that there was light at the end of the tunnel. So I encourage you to seek out those things. If you really don't feel like you've got someone that you can rely on and trust, or you don't feel ready to take that step just yet, listen to stories, podcasts like the Curbsiders. That's an internal medicine podcast. That's some great episodes on physician mental health. There are lots of physician podcasts that talk about burnout and about mental health in physicians. I have a podcast that I produced during the pandemic and some early this year as well, called Women Physicians Flourish, and a lot of that was about mental health. So there are also online private physician groups that will verify that you're a physician. You'll give them your NPI number, and they will allow you to post anonymously if you need support. And those can be great ways to go if you need a little bit of a lift before you get the courage to go seek help. But I think the most important thing for you to know is that this is temporary and treatable, and you are not alone. The third group of you that I want to talk to are those of you who may not currently be struggling or really know anybody who is, but you're interested in furthering protections for physicians who seek mental health treatment. So we know that there are barriers for doctors and nurses in seeking mental health care, and many of those are concerns over licensure and credentialing and like legal discovery that a physician has sought treatment for a mental illness. So there are licensure applications in many states, as well as credentialing for malpractice insurance and hospitals and insurances that ask these really broad, invasive questions about mental health, like these general statements like, have you been treated by a psychiatrist or by a physician for a mental health problem of any kind? We're lucky to be one of the states where our Board of Medical Licensure has adopted the attestation model, which basically just asks the question whether you're experiencing any mental or physical illnesses that impair your ability to care for patients, because that's really the only thing they need to know. So our Board of Medical Licensure has excellent policy there, but hospital credentialing and malpractice credentialing for most of us still have these invasive questions about whether we've been treated for any mental illness. And there's not any evidence that that question protects patients. And so it's also been shown to prevent physicians and nurses from seeking mental health treatment, for getting mental health treatment. So some of you have probably heard of Dr. Lorna Breen. She was an emergency room physician, I believe it's in New York, who committed suicide after the first wave. She avoided seeking help because she was convinced that she would lose her license. And she committed suicide tragically, and her family has established the Lorna Breen Healthcare Heroes Foundation, and they have been successful in getting a large bill through Congress that approved money for working for healthcare worker well-being and suicide prevention. So one of their main emphases right now is these invasive mental health questions on credentialing applications. So the Joint Commission and the Surgeon General have also kind of signed on to this and made statements asking organizations to eliminate punitive credentialing policies. There are also some states who have changed laws to require insurance for physicians to cover mental health care outside of their system, because what has happened in many situations is that a physician is essentially forced to seek care within their own. And so there's a move toward changing those laws, as well as laws that make seeking mental health care discoverable for malpractice for malpractice suits. Sorry. So that it's not immediately, it doesn't have to be disclosed unless it was directly relevant to the case. So some legislative things that I think there's a good group of us at MSMA who are interested in advocating for these. And so we may be asking for your support in supporting these changes soon. There's so much more that could be said, but one thing I'd like to say to those of you who know what it's like to experience this, I would like to challenge you, if you're up for it, to share your story. you probably have a similar experience to me in that other people sharing their stories was life-giving and life-saving for you. And so I think that's one of the most effective things for us to do. So I challenge you to do that. And thank you for listening very much. If there's ever anything that I can do, please reach out to me. There aren't a lot of Lauderdale's doctors in Mississippi, and I'm on Facebook where this is posted. So send me a message if there's anything that I can do for you. Bye-bye.